Hi, everybody. My name is Judith Bendersky, and I am pleased to present some CMS national training material to you on the topic of Medicare for people with end-stage renal disease. I anticipate that this will be approximately 45 minutes of rather dense information. I'll try to make it interesting and humorous if possible. This presentation is brought to you by the SHIBA program. Our full name is Statewide Health Insurance Benefits Advisors. We are also known as the SHIP, the State Senior Health Insurance Program that is funded by the Administration on Community Living. And we are housed in the Office of the Insurance Commissioner. We'll be looking at material from the Centers for Medicare and Medicaid Services, also known as CMS, because CMS administers Medicare. So this is a Washington state version of this information, and I will integrate some local Washington state agency information as we go. My name is Judith Bendersky, and I'm a gerontologist with a master's degree in public health, and my title is called SHIBA Field Supervisor. And again, I'm with the Washington State Office of the Insurance Commissioner. You should feel free to write down my email address. So grab a pencil or a pen, Judith B as in Bravo at oic.wa.gov. And my direct line, my cell phone, since I'm recording this during the COVID era and we're using cell phones and telework, is 360-250-6932. Regardless of where you are or what questions you may have, you should always feel free to call me. And if I'm not on another call, I'll pick up. Always leave me a message so I can return your call. Thank you. The topic is Medicare for people with end-stage renal disease. This training module explains Medicare for people with end-stage renal disease, which I will now be calling ESRD. This slide deck was developed and approved by CMS, the federal agency that administers Medicare, Medicaid, and the Children's Health Insurance Program, and the Marketplace. And the information in this module was correct as of June of 2020, with some significant changes and updates relevant to the Cures Act, which changes things for people with ESRD Medicare beginning January 1 of 2021. I would like to give you just a broad brush overview of the 5 lessons. In lesson number 1, we're going to define and describe ESRD. In lesson number 2, we're going to talk about Medicare enrollment based on ESRD and some of the differences between that and Medicare enrollment when a person has disability or transitions to Medicare due to age. In lesson 3, we'll talk about what Medicare covers. In lesson 4, we'll talk about coverage options. And so that's when we'll get into things like Medicare supplements, Medicare Advantage plans, and so forth. The session's going to help you understand ESRD, explain some of the nuanced eligibility and enrollment rules for people with ESRD, describe or at least point to the right place to go for information about what all the different parts of Medicare cover. That's what I call the alphabet soup of Medicare, the A, B, C's, and D's, and identify coverage options for people with ESRD. So let's get to it. With lesson number 1, we're going to talk about what is ESRD. ESRD is permanent kidney failure that requires either a regular course of dialysis or a kidney transplant. Many of you watching this webinar are practitioners of medicine or healthcare, work in dialysis facilities, and maybe more familiar with the specifics of dialysis and a course of dialysis for a patient than I am. So forgive me while I go over some basics. Kidney dialysis is a treatment that cleanses the blood when your kidneys don't work, gets rid of harmful waste, extra salt, and fluids that build up in your body. It also can help control blood pressure and help your body keep the right amount of fluids. Dialysis treatments may help you feel better and live longer, but they aren't a cure for permanent kidney failure. A kidney transplant, on the other hand, which is also covered under end-stage renal disease Medicare, is a surgical procedure that puts somebody else's healthy kidney into your body. The donated kidney does the work that your own kidney can no longer do. You may get a kidney from somebody who has recently died, or from somebody who is still living. It could be a family member or a friend or somebody that has matched, blood type and other conditions that will enable them to donate a kidney to you. The blood and tissue of the person who gives you the kidney must be tested to see how well they match yours so that your body won't reject the new organ. To be covered under Medicare, your kidney transplant must be done in a hospital that's Medicare certified to do kidney transplants. There are 5 stages of chronic kidney disease, which we refer to as CKD. And the National Kidney Foundation has developed guidelines to help identify those levels of kidney disease. If you have stage 5 of CKD, you may be eligible for Medicare based on ESRD. There is, and I'd like to recommend a really wonderful booklet. I'll hold it up, but I don't know if it will show up. Looks like it's showing up, but there's a really wonderful book put out by CMS. It looks like this, and it is called Medicare Coverage of Kidney Dialysis and Kidney Transplant Services. And it's was published in September of 2020, which means everything in here is accurate for January 2021 because the Medicare open enrollment season, October 15th to December 7th, is when many people who have ESRD, Medicare or not, are evaluating their Medicare options. So back to this slide deck, Medicare eligibility based on end-stage renal disease is a little bit tricky. So I want you to pay attention if you're a SHIBA advisor used to some of the other rules that we describe constantly throughout the year. For people with ESRD, you can get Medicare no matter how old you are. If your kidneys no longer work, if you need regular dialysis or have had a kidney transplant or are awaiting a kidney transplant, and one of these applies to you. You've worked the required amount of time under Social Security or the Railroad Board to be eligible for Social Security or Railroad Board benefits. Number 2, if you're already getting or are eligible for Social Security or Railroad benefits. Number 3, if you're the spouse or dependent child of a person who meets either of those requirements, and you fill out the correct application form for ESRD Medicare, and it's approved by Social Security. So you may have a child who's 2 years old, or an infant that's 6 months old, or a teenager, and you may get a call from the parent or the caregiver or the provider or the sister. And the patient may be very, very young, but qualify for Medicare due to ESRD. If you qualify for Medicare Part A, hospital insurance Part A, then you also qualify to get Medicare Part B for the medical insurance. Most people, as we know, most people pay a monthly premium for Part B as in boy. In 2020, it's around $145. We don't know at this point, and this recording is done November 2nd of 2020. At this point, we don't know what the 2021 premium will be. But it's best for people who have ESRD Medicare to enroll in both Medicare Part A and B to get the full benefits available under Medicare to cover certain dialysis and kidney transplant services. So let's do our first knowledge check. What's the minimum age requirement for Medicare eligibility based on ESRD? What is the answer? Pick your choice. 65 certainly is for Medicare due to age. The correct answer is there's no minimum age requirement for Medicare based on ESRD. A person could be 3 months old and have Medicare because their kidneys are not functioning adequately to sustain their life. Okay, that was a quick lesson. Lesson number 2 gets a little bit juicier. It's about Medicare enrollment. And this is where there's some very distinct differences with Medicare enrollment based on disability or age. A person who has ESRD can enroll in Medicare Part A and Part B at their local Social Security office. And there is a very specific form. It's called the CMS 2728. All you really need to remember is 27, and then you can remember to say 2728. The long name of the form is End-Stage Renal Disease Medicare Evidence Report, Medicare Entitlement and/or Patient Registration. And it's about a 6-page, very clinically oriented looking document filled out by the patient or the patient's family and a healthcare provider who ascertains that the person indeed has that level 5 or stage 5 CKD, chronic kidney disease. That form has to go to Social Security, and most social workers and dialysis centers and nephrology practices are aware of that. If you enroll, so if your client or you enroll in Part A and want to enroll in Part B later on and delay that enrollment into Part B, you may have a gap in coverage since most ESRD services are covered under Part B rather than Part A. So if you enroll in Part A and you wait and then you enroll in Part B later, you are subject to the general enrollment period, which runs January 1 to March 31st each year. And then the Part B coverage will become effective July 1 of that year, and you may be subjected to a 10% late enrollment penalty. So you would want to have good counsel before you do that. Now, if you're already enrolled in Medicare because you're 65 or older or you have disability, you may be paying a higher Part B premium because you didn't enroll in Part B when you were first eligible. If that's the case and you qualify for a new entitlement under Medicare due to ESRD, the penalty will stop when you become eligible for Medicare based on ESRD. The SHIBA advisors are very good about trusting and referring people to Social Security when it comes to some of those very technical determinations about whether there will be a late enrollment penalty or not. All right, so when does Medicare start based on ESRD? Medicare coverage usually starts on the first day of the 4th month of having a regular course of dialysis. Coverage can begin the 1st month of a regular course of dialysis if you participate in a home dialysis training program that's approved by Medicare. If your doctor expects you to finish training and be able to do your own home dialysis treatments. So that's different. And if you're eligible for Medicare based on ESRD, your coverage doesn't usually start until the 4th month of dialysis. Therefore, Medicare generally won't pay for anything during your first 3 months of dialysis, unless, of course, you happen to have Medicare due to disability or age. Or if you're covered by a group health plan, a GHP, group health plan, which could be your employer, your spouse's employer, your former employer, your retiree plan, a union, or other group health plan, in which case the group health plan is generally the only payer for the first 3 months of a regular course of dialysis. Once you have Medicare coverage because of end-stage renal disease, however, usually the 4th month of dialysis, your group health plan will pay first on your hospital and medical bills for 30 months, 30 months. And this is known as the 30-month coordination period. I'm trying to circle that here in this slide. 30-month coordination period. during which time, no matter how many employees work for the employer, or whether it's through you or a family member, or whether there's current employment, that's the 30-month coordination period. Medicare, your group health plan will pay first and Medicare will pay secondary or second. So the 30-month coordination period, and this is interesting and different from other aspects of Medicare, the 30-month coordination period starts the first month that you're able to get Medicare, that you're eligible for Medicare, even if you didn't sign up, even if you haven't signed up. So if you're covered by a group health plan, you generally have two options to get Medicare during the 30-month coordination period, or delay applying until after the coordination period. Now, there are some considerations, some things to think about. You may want to join Medicare during the 30-month coordination period because Medicare may pay the group health plan annual deductible, co-payments, or co-insurance. Or if you're getting a transplant soon, it's good to have Medicare Part A and B because Medicare will cover your immunosuppressive drugs. If you were eligible or had Medicare Part A, your immunosuppressive drugs will be covered under Part B. And there's coverage for a living donor if you have Medicare Part B, Part A and Part B. Now, delaying Part B or Part D could mean waiting for an applicable enrollment period to enroll and a possible late enrollment penalty. If you're covered by a group health plan, reasons that you may want to delay applying for Medicare include that if your group health plan pays all of your healthcare costs, with no deductibles, no co-insurance, and no co-pays, and hopefully covers your prescriptions, then you may want to delay enrolling in Medicare until shortly before that 30-month coordination period ends to avoid a break in coverage. Many group health plans will cut off or terminate primary payment after the 30 months. Now, this is all very confusing, but the good news is through 1-800-MEDICARE, there is a coordination of benefit contractor, and you can call the 1-800-MEDICARE and speak to the coordination of benefits contractor, and those folks are really good at understanding who pays first, who pays second, who pays third, and just be sure that you specify that you or your client or your family member has Medicare due to kidney disease or ESRD, and they will look at the right charts to guide you correctly. All right, so I'm going to repeat what I went over. If you're covered by a group health plan, you may want to delay applying for Medicare if your group health plan pays for absolutely everything. Because you'll be paying, if you pay for Medicare, you'll pay a monthly premium for Medicare. But if you pay a deductible or co-insurance under your group health plan, then enrolling in Part A and Part B really could be a benefit to you because it could pay those costs. If you enroll in Part A only, but delay Part B, you won't have the Part B premium during this time. But remember, you may have to wait until the next general enrollment period, which, if you know me, I call it the doghouse period, to enroll, and you may have a late enrollment penalty. But if you enroll in Part A and delay Part D, as in drugs, you don't have to pay the Part D premium, but you may have to wait for an open enrollment period between the following October 15th to December 7th to enroll into Part D, as in drugs. And if you didn't have creditable prescription drug coverage when you had Part A, but chose to not have Part D, you may pay a late enrollment period for Part D, as in drugs. If you want more information about these late enrollment penalties, you should feel free to call, and I'd love you to jot down the 800 number to Sheba in Washington, which is 1-800-562-6900. And we can, any one of the advisors that you speak to, or if you speak to a Shiva staff person in Tumwater, we can get into further detail with you on the late enrollment penalties. Okay, let's talk about some more enrollment considerations related to immunosuppressives. So this is specifically for people who either are waiting for, are having, or had a kidney transplant. Immunosuppressive drug therapy is also known by some people as the transplant medications or the anti-rejection drugs. Immunosuppressive drug therapy is only covered by Part B if you are entitled to Part A at the time of the kidney transplant, as long as the transplant was performed in a Medicare-approved facility and Medicare paid for the transplant, or Medicare was the secondary payer. So people who don't meet those conditions for Part B, coverage of immunosuppressive drugs may be able to get coverage by enrolling in Part D as in drugs. So let's think about that for a minute. Original Medicare Part A and B, and specifically Part B, will cover immunosuppressive drugs at 80%. Now, the person hopefully then has a Medicare supplement to help cover the remaining 20%, or starting in January 2021, remember, people with Medicare due to ESRD only can enroll in a Medicare Advantage plan, which of course has doctor visits costs and out-of-pocket maximums and a variety of other co-insurance costs. So if you have Medicare Part A and B and you get a kidney transplant, then your immunosuppressive drugs will be covered by Part B. If you don't meet the conditions of having had Medicare or having not having had Medicare in a approved facility, then you may be looking at getting Part D as in drugs for your immunosuppressives, and you may have a 25% out-of-pocket costs for that, for those medications, and there isn't necessarily a policy that will fill that gap. So Part D is kind of another study in itself, but you could be more out of pocket with Part D, so that's a consideration. Okay, if you're eligible for Medicare coverage based solely on ESRD, your Medicare coverage will end 12 months after the month that you stop a regular course of dialysis treatments, or 36 months after the month you've had a successful kidney transplant. So that's another thing that's really different about ESRD Medicare, is that Medicare ends. It doesn't go on for decades until you qualify for Medicare due to age or some other entitlement. So Medicare coverage ends 12 months after the month you no longer require a regular course of dialysis, or 36 months after the month of a successful kidney transplant. Now, are there exceptions to that? This is Medicare, of course. So Medicare coverage will continue without interruption if you start a regular course of dialysis again, or get a kidney transplant within 12 months after you stopped getting that regular course of dialysis, or if you start a regular course of dialysis or get another kidney transplant within 36 months after that original transplant. And in that case, you don't need to reapply with the Form 2728 for Medicare again. So that's when Medicare continues. Okay, but Medicare coverage will resume with no waiting period if you start a regular course of dialysis or get a kidney transplant more than 12 months after you stopped getting a regular course of dialysis, or you get a regular course of dialysis or get another kidney transplant greater than, more than 36 months, then you must reapply for that entitlement to ESRD Medicare with that Form 2728. Those rules are tricky, and I'm not expecting you, I don't even expect myself to remember that. I go back to the book or back to these slides. So let's check your knowledge. For those with Medicare due to ESRD who have an employer or union group health plan, the employer or the union group health plan must pay for how many months? The correct answer is 30. This 30-month rule is unique to ESRD Medicare. The 30-month rule does not apply to any other part of Medicare. So if you are hearing people talk about 30 months, they're probably talking about ESRD Medicare. Let's go to another knowledge check. If you're getting a regular course of dialysis in a Medicare-approved facility, when will your Medicare coverage based on ESRD start? I hope you were correct. The first day of the month of dialysis. All right, the plot thickens a little bit as we talk about what Medicare covers. And I do want to let you know that this is a pretty broad brushstroke of the ABCs and Ds of Medicare. The Sheba sponsors, we all offer lots more in-depth conversations and webinars and face-to-face and Zoom conversations one-on-one about the different parts of Medicare. So this is broad brushstroke. As a person entitled to Medicare based on ESRD, you're entitled to all Medicare Part A and Part B services covered under Original Medicare. You can also choose to get prescription drug coverage, Part D as in drugs. You can also choose, effective January 1, 2021, to choose Part C as in cat, or C as in Charlie, and we know that as Medicare Advantage plans or special needs plans. If you have Medicare based on ESRD, your covered treatments and services are covered by Part A or Part B. They also may be covered under Part C, Medicare Advantage plans, to include inpatient dialysis treatments if you're admitted to a hospital under a Part A stay, but more typically outpatient dialysis treatments through a Medicare-approved dialysis facility or a facility or in your home. Outpatient doctor services, home dialysis training, home dialysis equipment and supplies, certain home supports, which may include visits by a trained dialysis facility worker or hospital worker to check on your home dialysis to assist you if there's an emergency. Okay. There are two types of dialysis treatment options. Hemodialysis uses a special filter called a dialyzer to clean your blood. The filter connects to a machine. During treatment, your blood flows through the tubes into a dialyzer to clean out wastes and extra fluids. And then the newly cleaned blood then flows through another set of tubes back into your body. So that's hemodialysis. The other type of dialysis treatment that will be covered is peritoneal dialysis using a special solution called dialysate that flows through a tube into your abdomen. After a few hours, that dialysate takes wastes from your blood and is drained from your abdomen, which is then filled again with fresh dialysate, and the cleaning process begins again. So you will be working with your healthcare team to decide which type of dialysis will work best for you. Some of the most common dialysis drugs covered by Medicare under the ESRD provisions are heparin, an antidote for heparin. Those have to do with your blood clotting factors, topical anesthetics, and erythropoietin stimulating agents known as ESA for managing anemia related to your renal disease. Part B covers training for home dialysis, but only by a facility certified for dialysis training. You may qualify for training if you think you would benefit from home dialysis treatments and your doctor approves. And in the age of COVID, everything is changing and more people are doing lots more medical procedures at home or telemedically. So explore that with your caregivers and your healthcare professionals. Training sessions occur at the same time that you get dialysis treatment and are limited to a maximum number of sessions. Your dialysis facility will be responsible for providing all of your home dialysis related items and services, including equipment and supplies. However, dialysis suppliers may provide equipment and supplies under arrangement with your dialysis facility. Now, it's important to know that Medicare doesn't pay for everything. Medicare doesn't cover everything. And so some things that are not covered by it with ESRD Medicare include dialysis aides who may help you with self-dialysis, any lost pay to you or a family member who's helping you during self-dialysis training, housing or a safe, hygienic environment for you to stay in during your treatment is not covered, and blood for home dialysis, except with some exceptions, blood or packed red blood cells used for self-dialysis, unless that's considered medically necessary and part of a doctor's service. In some cases, Medicare will cover an ambulance transportation, which will be really non-emergency transportation, and that may help people who do not have access to somebody who can drive them to a dialysis facility. But it's considered medically necessary, non-emergency, scheduled, repetitive ambulance services. The ambulance supplier must get a written order from the doctor before you get the ambulance service. And the doctor's written order has to certify that ambulance transportation is medically necessary, and it must be dated no earlier than 60 days before you get the service. Now, if you are in a Medicare Advantage plan, the Medicare Advantage plan may cover some non-ambulance transportation to dialysis centers and doctors' offices. Some of the Medicare Advantage plans do have built into their plan a transportation benefit. So you will have to read or call and talk to the particular Medicare Advantage plan to find out more information about non-ambulance transportation for dialysis. There are Medicare covered services for transplant patients. Although Medicare covers medically necessary hospitalizations for ESRD, those who are undergoing a kidney transplant have special coverage as long as their kidney transplant is done in a Medicare approved hospital. That is a hospital that's not only Medicare approved, but it's approved to do kidney transplants. And Part A will cover not only the care given to the person who needs the transplant, but also kidney registration fees, laboratory and other tests needed to evaluate your medical condition, laboratory and other tests needed to evaluate the condition of a potential kidney donor, the cost of finding a proper kidney for your transplant surgery, if there is no living kidney donor, the full cost of care for your kidney donor, including their care before surgery, during surgery, and after surgery. Part B transplant patient coverage includes doctor services for the kidney transplant, doctor services for your kidney donor during their hospital stay, immunosuppressive drugs, and again, the full cost of care for your kidney donor. So let's do a quick knowledge check. Which service is covered by Part B? You might want to just eliminate the things that you know are not going to be covered by Part B, and that leaves you with B. The cost of finding the proper kidney for your transplant surgery, which takes an enormous amount of dedication and effort by really talented, wonderful people on the kidney transplant team. That's covered by Medicare. All right, we're going to go into the final lesson. So thank you for hanging in there. We're almost done with some of the really technical stuff. We're going to talk about coverage options. So Medicare supplements, which are also known as Medigap. Those are the 20% plans that shadow and pay after Medicare, original Medicare pays first. We're going to talk about Medicare Advantage plans, including special needs plans, which are newly available to people with ESRD Medicare beginning January 1 of 2021, but are able to enroll into one in open enrollment period in October 15th to December 7th of 2020. We're going to talk a little bit about prescription drug plans, Part D, as in drugs. So buckle up. We're on the last lesson. So Medicare supplement or Medigap policy is sold by private carriers that fills the gaps after original Medicare pays first. The Medicare supplements in the state of Washington are regulated by the Office of the Insurance Commissioner. And just in case you don't have it, I'm going to read out that phone number at 1-800-562-6900. For people under 65, we like to encourage you, as soon as you become eligible for Medicare, if you're under 65, to contact the healthcare authority. They sell a Medicare supplement to people under 65, but there are very strict enrollment and eligibility guidelines. So you don't want to wait a year and then try to enroll. You might have exceeded your any guaranteed ability to enroll. All right, if you have ESRD, you'll get healthcare usually through original Medicare, but you can join an MA plan anytime, a Medicare Advantage plan anytime after January 1st, 2021. Special needs plans are specifically designed for people who qualify for both Medicaid and Medicare. In that case, Medicare is the primary payer. Medicaid pays secondary. Medicaid in Washington is known as Apple Health. And there are a variety of Medicaid programs. Some pay everything after Medicare pays first, and also offer things like dental, vision, transportation, and so forth. And other Medicaid programs really just help pay the monthly premium for Medicare. But there are special needs plans in some counties in Washington, but not all. Medicare prescription drug coverage, also known as Part D as in drugs, is available to all people who have Medicare. And the great thing about Medicare Part D as in drugs is you can have Part A or Part B or both and still enroll into Part D. And that covers, pills, creams, shampoos, lots of medications that may be self-injected. And if a person didn't have Medicare Part A and they had a kidney transplant, then they're going to probably get immunosuppressive drugs through Medicare Part D as in drugs. Medicare Part D will also pay for other prescriptions related to other conditions that you may have aside from end-stage renal disease, such as high blood pressure or a skin rash from an allergy. There are excellent extra help programs to help people with a limited income and limited resources. Those thresholds change every year, but are in the ballpark of, for a single person, an income of $1,600 a month, and assets or resources no more than, let's say, $14,000 in the bank. So if there's any question about whether you might qualify for extra help, please call the Sheba phone number at 1-800-562-6900, and we'll screen you and talk to you and help you apply for extra help if we think you would possibly qualify. All right, here's a knowledge check. Starting January 2021, people with end-stage renal disease can join a Medicare Advantage plan. Is that true or is that false? The good news is that's true. And really, that's why we're meeting today, to make sure that you know that big change and that new option available to people. What Sheba is about is helping people understand what their options are and really helping protect the most vulnerable consumers. So thank you for your time. I'm going to briefly review some resources. This is going to be brief. There's the Advancing American Kidney Health Initiative. There's a compare tool on Medicare.gov to compare dialysis facilities. There's a wonderful network of end-stage renal disease. There's the Fistula First Alliance. And I want to give you the Co-Imagine Health, which is the ESRD network that includes Washington, Network 16 at 1-800-262-1514. There's a wonderful team of people there with educators and nurses and social workers and advocates. You can also go to Northwest Renal Network, or nwrn.org. Here is the Sheba phone number. Social Security, if you need to call them, is at 1-800-772-1213. I went by all of that extremely fast. So you should feel free to call me or Judith B at oic.wa.gov if you want to email me. A few key points to remember. ESRD is for people who have permanent kidney failure and either require dialysis or a kidney transplant to sustain life. People can be 2 years old, 6 years old, 8 years old, 48 years old. So there's really no age requirement, but there are some Social Security related requirements to either be eligible for Social Security, the spouse or a child of somebody who meets some of the Social Security requirements. There's a period of time when the group health plan, if there is one in the picture, pays first and Medicare pays second. That's that 30-month coordination period. Starting in January 2021, people with ESRD may join a Medicare Advantage plan. And there are some nuances with which part of Medicare will cover the immunosuppressive drugs, the anti-rejection drugs, that is for people who may have had a kidney transplant. They're covered by Part B for people who had Part A, were entitled to Part A at the time, and otherwise they're covered under Part D, as in drugs. It's a lot to remember, so I don't try to remember it, and I recommend a publication from CMS that's called Medicare Coverage of Kidney Dialysis and Kidney Transplant Services. And you should also feel free to call the Office of the Insurance Commissioner at the phone number on the slide, 1-800-562-6900. If you have questions about any other aspect of insurance and you live in the state of Washington, we all work to serve you related to homeowner insurance, auto insurance, fire, theft, crops, annuity, you name it, landslides. Give us a call and let us assist you. It'll be our pleasure to assist you. Thank you very much for your time.